Welcome to my SN Pharma online classes. Today I am going to discuss about antitussive agents. Here, first of all, we know the meaning of cough. Here, what is the meaning of cough? We see the physiology of cough. It is nothing but it is the reflex mechanism of our body. Here, how it happens. If any type of allergens or irritants which is enter through the air inside the nose, what happen? Our respiratory tract, they contains chemoreceptors and mechanicoreceptors. When there is any type of allergen which is enter in our nose through the air, what happen? The respiratory tract which contains the chemoreceptor and mechanicoreceptors, they are get activated. This result the message which is goes from the receptor toward the brain, mainly in the medulla oblongata. In medulla oblongata, the one region is present called as nucleus tractus solitarius. In this area of the medulla oblongata, cough centers are present. This result, there is a activation of cough center in this area, NTS area, which result again the message which is move from the afferent neuron called as motor neuron toward the respiratory tract. This is about basic mechanism. When this moves toward the respiratory tract, then followed by here there is three phases are activated. One is inspiratory phase. Here in this inspiratory phase, what happens? The deep breath in, and which result in the stretching of the expiratory muscles like intercostal muscles, abdominal muscles. Then automatically the pressure which is created inside the lungs is more. Then second is compression phase. Here in this phase, what happen? Gluteus is closed, which is this gluteus which is present in the throat area, here it is closed. Again the respiratory muscles are going to contract. Then the more pressure should be built inside the lungs. Then finally what happen? Expiratory phase. Then finally the gluteus which is opened and the air which is pushed out from the lungs. Result, there is a expiration result in the form of cough. This is the basic mechanism of our cough. Here we see the agents, classifications of antitussive. Here first classification is peripherally acting antitussive agents. Peripherally nothing but away from the brain and spinal cord. Peripherally, name itself says that our drugs, peripherally acting drugs, they are mainly act on the receptors which is present on the respiratory tract. This here what happen when this peripherally drug, example prenoxidazine and benzoate, these drug they act on the mechano and chemicoreceptors, which result there is a no, if entry of allergen also, there is no activation of this receptor because it is blocked by prenoxidazine and benzoate. This result, there is no sensation goes toward the brain in the region of NTS. Means there is no synapse of neuron take place. Means there is no interconnection of neuron, one neuron to another neuron take place. This result, there is no information goes toward the respiratory tract and finally leads to there is no cough. This is about peripherally acting antitussive. Next, centrally acting antitussive. Name itself says that centrally acting means here these drugs act on the medulla oblongata, mainly in the nucleus tractus solitarius, because in this area cough centers are present. These drugs, what happens? Centrally acting drugs, they mainly act on this NTS area on the cough center, in the result in inhibition. Here what happened? There is a result in inhibition and there is no interconnection or there is no information goes from pre-neuron to post-neuron. This result, there is no activation of post-neuron and there is no activation of respiratory tract. Then finally leads to no cough. Means our drugs, centrally acting anti-tussive drugs, they are mainly act on the brain of medulla oblongata in the region of NTS. They mainly inhibit the cough center which are present in the NTS, and there is no interconnection, there is no synapse in between the neuron. These are all about centrally acting anti-tissue drugs. See the examples. First one is opioid drugs, and another one is non-opioid drug. In opioid drug, example is codeine and falcodine. Falcodines are long-acting drugs and they produce sedation and addiction. And non-opioid drugs, examples are dextromethorphan and noscapine. They are non-addiction. This is the basic of about anti-tissue drug classification.